Western Australian arrangement put in place to continue to keep our state safe and strong. And it has worked. It has worked. As of today, Western Australia has now gone 233 days without a single case of COVID-19 in our community. A remarkable achievement, thanks to the efforts of every Western Australian. Western Australia's border controls have been highly effective in reducing the number of potential cases of COVID coming into WA. From November 14, travellers from all states and territories that were deemed very low risk were permitted to enter WA if they complied with conditions. Travellers from low-risk states, that is Victoria and New South Wales, were also permitted to enter WA. However, additional strict measures were placed on these people, including a requirement to take a COVID test on arrival at Perth Airport, if deemed necessary by a health clinician. The requirement to self-quarantine for 14 days in a suitable premise, and the requirement to present for a COVID-19 test on day 11 of their arrival in Western Australia. The controlled interstate border is a careful and cautious approach. It faced its first test only the day after it came into effect due to the concerning outbreak in South Australia. I always said we would not hesitate to reinstate the hard border if the health advice recommended it, and that's exactly what we did within hours in response to the situation in South Australia. When we announced the controlled interstate border, I also said the Chief Health Officer would closely monitor the situation in Victoria and New South Wales. Our main benchmark has been that they record no community cases for COVID-19 for 28 days. Victoria reached that milestone last Friday, and we hope New South Wales can reach that milestone this coming Friday. It has been a remarkable effort from Victoria in particular. Given the position they were in just a few months ago, it's an outstanding achievement, unrivalled around the world. As a result, our Chief Health Officer has assessed the situation further, taking into account testing regimes, border controls, and the recent outbreak in South Australia before providing updated health advice. Yesterday afternoon, the Chief Health Officer provided that advice to us, which has allowed us to make another safe and cautious decision. So I can now announce the following, based on updated public health advice and pending no further community outbreaks. Effective from 12:01 a.m, Tuesday, December 8, Victoria and New South Wales will be categorised as very low risk under our controlled borders. They will join the ACT, Queensland, Northern Territory and Tasmania as very low risk jurisdictions. Therefore, travel will be permitted to WA from these states with the following conditions. 1. All Perth Airport arrivals must undergo a health screening and temperature test on arrival. 2. Travellers must be prepared to take a COVID-19 test at the airport COVID clinic if deemed necessary by a health clinician. 3. Travellers must complete a G2G pass declaration stipulating they do not have any COVID-19 symptoms and which jurisdictions they have been in over the past 14 days. 4. Travellers must confirm they have not knowingly mixed with anyone from South Australia. And 5. Land arrivals will be met at the border checkpoint for a health screening and to have their G2G pass declaration checked. 14 days of self-quarantine will no longer be required from December 8, with Victoria and New South Wales falling into line with other Australian jurisdictions except for South Australia. I'd like to acknowledge and thank everyone for their patience and understanding, not only in recent weeks, but over the course of this pandemic. It's been a long wait. Our first border controls were introduced all the way back in March, 9 months ago. As a country, I'm so relieved we've gotten to this point. It's a credit to all Australians. that we are nearly at the point of eliminating the virus in the community. The Chief Health Officer advised us that the updated controls for Victoria and New South Wales could come into effect on or after the 4th of December. Together with the Police Commissioner, the Chief Health Officer and the Health Minister, we decided to give everyone a few days before we implemented the changes. This allows for people to adjust travel arrangements if necessary, airlines to put on additional flights, Perth Airport to prepare for the changes, and our police force and health staff the time needed to implement the changes. We're also just being that extra bit cautious. We can take this next step safely and cautiously thanks to the recent success of our friends over East in getting the spread of the virus under control. I make the point again, we will not hesitate to reinstate the hard border if there are outbreaks over East and we get medical advice to do so. I know the past 8 months has not been easy. Past 9 months has not been easy. I know the border arrangements have put pressure on families and have at times been hard to comprehend. I never thought, as Premier of the state, I'd be bringing in state border controls. It definitely has been an extraordinary year. But I want to thank all West Australia. I want all West Australians to know that every decision we've made throughout the pandemic has been made to protect our community based on expert health advice. I have sympathy for those who've been impacted. I look forward to Western Australians being able to see friends and family from New South Wales and Victoria under our controlled border regime. My parents live in New South Wales, so personally for me, it's a relief knowing that my parents are now safer at their home, and hopefully I might be able to see them sometime in the future. Regarding South Australia, we are not yet at the point where we can relax the current border controls. Travel from South Australia remains prohibited unless travellers meet the strict exemption criteria we introduced on November 16. South Australia will remain in the medium risk category and at least until December 11. A review into this arrangement will be undertaken next week. I also want to be clear that if people are thinking of driving from over East through South Australia, you'll be then treated as travelling from South Australia. Anyone who has been in South Australia in the previous 14 days will then not be permitted to enter WA unless they meet an exemption criteria. I also can provide an update on the 2 square metre rule. Effective from today, places of worship will be exempt from the 2 square metre rule and will be able to operate at a 60% capacity. This follows the same arrangements we have introduced for many other venues, including theatres and cinemas. I'm glad we can take this step and thank those people for their patience and understanding whilst we assess the situation before making this decision. Western Australia does remain susceptible to an outbreak, given nearly all physical distancing and gathering restrictions have been removed. And while the 2 square metre rule does act as an impediment to some sectors, it is in place to better protect the health of the community. So I want to take this opportunity to remind everyone to download the Safe WA app. Our mandatory contact register systems will come into force from this Saturday. So to help keep WA safe, download the Safe WA app. If there was an outbreak, it would help prevent this unpredictable virus from ravaging our state like it has other parts of the world. I'll now take any questions.
Controlled border arrangements are already in place in very low-risk states. Why can't it be done today or tomorrow for Victoria and New South Wales? Why is the extra week necessary?
Well, New South Wales doesn't reach the 28-day mark until Friday of this week. What we've decided to do is to be that little bit extra cautious and delay the changes to Tuesday of next week. We make no apologies for being...
Please do not leave bags unattended. Your safety and security is the highest priority at Perth Airport.
Safety and security.
Look, we are just cautious about these things. It also gives time for the airport to get ready, for our health and police to change the arrangements and the directions. All of those things, we want to make sure they're all exactly right before we implement the changes. December 8 is an appropriate time to implement the changes.
You were about to say we make no apology. Will you apologise to people arriving from Victoria today and tomorrow who will have to stay in quarantine even after December 8 and therefore can't hug their mum at a family funeral?
Look, it has been a difficult year, and there's been lots of changes made over the course of this year. And of course, I have sympathy for people who've had to endure some of the measures we've put in place. But we've done it for all of the right reasons. We tried to keep our state safe, we've tried to keep people healthy, we've tried to stop the virus coming in, and the measures we've put in place have worked. All of the measures that Australia has put in place have not been perfect, but they've been done with the right intentions, and in the West Australian case, they've been absolutely incredibly successful and worked to keep the virus out. So we'll just continue to do what is right based upon medical advice.
Will quarantine be shortened though for those people? Why should they have to stay in quarantine after December 8?
No, well,
Victoria's currently already past 28 days community transmission free.
we will continue to be safe and cautious about all of these matters. The border arrangements will change on December 8. On that morning, people will be able to come in from Victoria and New South Wales, but they'll still have to fill in the G2G pass. And the thing to note here is Western Australia, of all the states, will be the only one still with a controlled border in place. So you'll need to go through health screening, health checks, you'll need to put in place the G2G pass. It's not completely free movement. And what these measures mean is if we need to overnight scale up the border, we can do it in a matter of hours.
Sorry, can you answer, so people arriving today, tomorrow from Victoria, COVID-free more than 28 days, will have to stay in quarantine another week after December 8?
Yeah, look, the measures we have in place are based upon medical advice, they're based upon safety. I understand there will be inconvenience for some people, but we're doing everything we can to keep Western Australia safe and keep COVID out of our state. Well, if you come via South Australia, you can only come in if you are exempted. So you can't just...
For everyone's health and safety, please remember to practice social distancing at Perth Airport.
Right. If you come via, if you come via South Australia, you have to have an exemption, and so they're very limited categories. So I just urge caution with South Australia. We'll review that over the course of the next week. From December 11, that may change, but we haven't made a final decision on that at this point in time.
Do you have any idea how many people are waiting to come to WA from New South Wales?
Look, people from New South Wales and Victoria can come now. They're required to quarantine and receive testing. That's the current arrangement. I expect there'll be more people come because in the lead up to Christmas, people want to come back and see family and friends and the like for Christmas, so I expect there'll be a lot more. The exact numbers we don't know.
What's your advice to any West Aussies travelling overseas this Christmas? Do you recommend it?
Well, not to South Australia at this point in time, but if you want to go to the eastern states, you're free to go and you're free to return home subject to the G2G pass. I just warn people that if there's an outbreak, we'll put a hard border up again. So people just need to be aware that we don't hesitate to put in place rules to protect the state. But if people want to go over east to visit family or friends or have a holiday, except for South Australia at this point in time, they'll be free to do so. No, I've got a few things on. So no, I won't be doing that. Obviously it'll be a very busy period for me.
Do you expect that they might be
For Christmas, no.
in the event of the hard border being put up in the event of an outbreak, will West Aussies who have travelled interstate in that time have the opportunity to get back?
Well, what happened when we had to reinstate it with South Australia is as you recall, it was only 2 or 3 weeks ago, we had to reinstate the hard border, and we said, if you've gone to South Australia, come home now. and we provided a compassionate exemption for West Australians returning home. So just make people aware that if you want to go east, you're free to do so with the exception of South Australia. But if we have any outbreaks, if we have any problems, we won't hesitate to put in the hard border again.
How long does that compassionate exemption last? Is it, people have 48 hours?
Well, in the case of South Australia, it was basically a few days, and you found that the people coming back to Western Australia from South Australia were generally West Australians who travelled to South Australia. So, we'll play it by ear depending upon the nature and size of any outbreak and the like. But the good thing is, New South Wales and Victoria have done a great job in eliminating the virus, subject to New South Wales getting to 28 days later this week. So the good thing is, and I mean, I've got to say this about the entire country, the National Cabinet has worked, the states have worked, admittedly at our own pace and in different ways, but the measures across the country have worked. If you compare our federation with other federations around the world, where there's been no cooperation, no measures put in place like the United States, our example is a shining light to the world.
Do you think the fact we've been telling people to stay away for several months now means it's going to discourage tourists from coming back?
Look, I doubt that. What I find is when I speak to people from the east, or you hear from people over east, they always remark how successful Western Australia has been and what a safe, secure, exciting, happy place it is. So I expect there'll be lots of tourists wanting to come to Western Australia. But I just make the point, they still have to get through the controlled border and be subject to health checks. So when Victorians go to Queensland or Queenslanders go to Tasmania, they don't have any controlled borders. We will still have a controlled border where you have to go through the health checking process. You have to fill in the G2G pass. We can still track and trace you. All those sorts of things will be in place for WA.
Not sure if this has already been asked, but if New South Wales doesn't make that 28 days, will we still open to Victoria?
I would doubt it, but we'll just wait and see. So it's Friday.
Are you satisfied that the stricter border arrangements haven't been in place here a day longer than necessary?
Yeah, look, we've done this for health reasons. I mean, I know there's scepticism and, people over east and some commentators, have attacked us over the course of this year. But we've done this for health reasons, and the economic results as a consequence have been outstanding. There's nothing more to it than that. We just wanted to keep our state safe and strong over the course of this year. And the measures we put in place, whilst they've been attacked, in particular in the eastern states, they've worked. And our outcomes have been so much better, so much stronger. Our health outcomes have been outstanding. Apart from some Pacific islands, I doubt there's anywhere in the world that can say they've gone 9 months without a single community case of COVID-19. 9 months. There's nowhere else in the world that I can think of, apart from some isolated islands in the middle of the Pacific, that can say that. So our outcomes in a health sense have been outstanding. And if you have a look at the economy, the economic success of the state is there for all to see. So we've done everything to protect the health of West Australians. The health outcomes have been outstanding, and our economic outcomes have been terrific as well.
Are those economic and social outcomes now at risk? The AMA and others have warned that because of the lack of social distancing here, the complacency, that if there is an outbreak, it will spread quicker here than elsewhere.
Well, that's why we've got the contact tracing register coming in on December 5. That's why the QR codes are now there for people to download. That's why we have the controlled border in place. That's why we have people, when they come in from anywhere, including returning West Australians, having to verify they haven't been unwell and give us their contact details. That's why we've got a whole range of measures in place to protect the state. But you need to remain aware. We live in a world that is full of COVID. You see the outcomes in America with mass deaths, in Britain mass deaths, all over the world this is occurring. That's why we will continue to be cautious in our approach.
Just to pick up on Chris' question quickly, so if there's a new case of New South Wales before Tuesday, we won't open Victoria either.
May well be the case. We'll wait and see. depends where it is, who it is, how widespread it is, all those sorts of things. We've sort of treated Victoria and New South Wales together because they have those big border communities, because they've had a lot of interaction across those borders. And so we'll wait and see what happens in New South Wales and Victoria. We're not expecting another case in New South Wales. They've now gone 25 days, I think it is, without a single community case. So we're not expecting one. If one comes up, we'll make that decision then. Well, I think West Australians have behaved appropriately, but what I'd urge everyone to do is download the QR code and fill out the contact registers. Don't go to work or out if you're sick, and get tested if you have any concerns.
Now that you've had 24 hours to absorb the situation with China and the tweet issued by the foreign officials yesterday, how alarmed are you by the situation, and is it fixable?
Well, firstly, look, it was all sprung on me yesterday. I hadn't seen it before the press conference, as you know, but obviously it was unacceptable. The image was clearly not an actual image, and it was unacceptable that it be promoted in the way that it was, and I just want to make that completely plain. So members of the Defence Force who might have been offended, I understand and sympathise with anyone who may have been offended. Clearly, in our relationship with China, we need to have cool heads. We need to have an approach that resolves issues. And I just urge everyone in both governments to get back and talk to one another, resolve issues amicably.
Do you think China still wants to resolve issues amicably?
Well, look, we've been partners, if you like, friends, despite our different political systems, for 50 years. And that's had huge benefits for both countries. And throwing away a friendship, as you all know, you wouldn't do lightly. So I just say to everyone in both national governments, let's get back and talk and seek to resolve and get back onto a level footing.
Tariffs on wine. Are you concerned for iron ore or other industries?
I am concerned. And so, you know, here we all are at this lovely airport. We all have a wonderful life. It's built upon strong export industries. And I just want us to continue to have good, friendly relationships with our long-term trading partners. They buy an enormous amount of our products. We buy a much smaller amount of their products. It's been a beneficial relationship for both countries, and I think we need to make sure that we have cool heads and work things out by discussion rather than confrontation. Not in the past 24 hours, but obviously the business community and therefore their workforces are very concerned, And whilst the tweet was clearly unacceptable, we need to, having made that plain, get back and talk and have cool heads in the relationship.
What's your reaction to exactly the current former Navy staff, his chief of staff, that staff, quite praise for like this?
I'll leave the Liberals' employment arrangements to them.
Thanks everyone.
Thank you. Thanks everyone. We're going to catch a plane. Off to Geraldton.
A couple of things. What are a couple of things? Oh, I see. Yeah, yes. Oh, okay. Yeah. Sorry, my apologies. Yes. It's just a very marked day. Yeah.
There have been warnings from the AMA and the like that WA is not ready and is at great risk when these borders reopen.
Well, it's the reason why we didn't move to phase 5 of the easing of restrictions. The 2 square metre rule is an important part of making sure we continue to remind Western Australians to practice good physical distancing, good personal hygiene, and of course get yourself tested and stay away from work if you're unwell. The QR codes will be an important part of maintaining our contact tracing capacity, And certainly the contact tracing which we've done at South Australia has been an important part of continuing to make sure that we refine those tools. I think we're in a good position in Western Australia. I want to just in particular highlight our response to the outbreaks in South Australia. The fact that we had our G2G pass application meant that we could contact trace over 600 South Australians within 24 hours after the outbreak was reported. So all these measures go to point to our readiness in the event of any outbreak. By and large, I think people understand that they need to continue to remember that. But of course, we're all, from time to time, guilty of not observing it. But we just need to continue to remind ourselves and each other that good physical distancing is an important reminder that the COVID-19 pandemic is still amongst us. One of the points that the Chief Health Officer highlighted is that we have between 80 and 90 positive cases recorded each week across the nation, made up of people coming from overseas. So the virus is still very much amongst us, and we have to continue to make sure we have all the measures in place to ensure we keep everyone safe. Well, we can expect the vaccine at this point in time as early as March next year. So we could certainly anticipate that a holding pattern while we have our borders as open has been announced by the Premier today. Look, I don't see the need at this stage to go to phase 5 of the easing of restrictions. I think the point we're at is that point where West Australians feel safe and cautious, but observing that the public health risk is now reducing. Yes.
Is the advice for people travelling into New South Wales and Victoria that they put on a flight this week, just next week?
Well, this is one of the reasons why we've provided everyone with a week's notice. It just allows people to sort things out, allows time for the airlines to put extra flights on. And obviously, if you're anticipating coming to Western Australia in the coming week, you may wish to consider just delaying your departure by a few days and enjoying free passage through the airport, subject of course to your G2G application and your health check.
Can some extra lenience be granted to people arriving today for things like family funerals from Victoria, which is COVID-free for 28 days, and yet they'll still have to quarantine after December 8th?
Well, the Police Commissioner and the Chief Health Officer make the calls in relation to exemptions, and particularly on compassionate grounds. But it's been the case that every time we have announced a change, there's always a period of time where some people are inconvenienced because they're either in quarantine or indeed in hotel quarantine and have to complete the direction which has already been given to them by the police force. So we understand these are inconvenient matters, but we try to take the best possible approach. See, he's reminding you, Jess, social distancing. Yeah, any other questions? Great. Thanks very much, everyone. I think they're setting you up for that. Sanitize away.
We'll do this one.
Premier.
Whatever. Hi everyone.
Good morning, Premier. How are you?
Thank you for meeting us. I'll give you an elbow.
Jeff.
Jeff, hi.
Sue, Dave Finch.
David. Brad Robinson. Brad.
Nice to meet you, Sue. How are you?
How are you? All know Roger?
Yeah.
Hi guys, how's it
How are you?
Yeah, very well today.